The second type of lower back pain is called facet or arthritic pain. The facets are the joints in the back part of the spine. They're like the guardrails of the spine. They help control motion and prevent you from moving too far in one direction. But when those joints get compressed over and over again, they become irritated, inflamed, arthritic, and painful. And this is really common in people who have a big arch in their lower back, sometimes called sway back, or people who stand and walk um, with the low back compressed. It's common with degeneration and arthritis. So facet pain usually feels like pain across the lower back. It typically does not shoot down the leg. It may feel worse when standing or walking or leaning backwards, and it feels better when you're sitting or bending forwards. So this is the person who says, "I can sit and feel okay, but if I stand too long, my back starts to kill me." Or walking through the grocery store is awful unless I lean on the cart. Now, the grocery cart example can also overlap with stenosis, which we'll be talking about in a minute, but it's a big clue that extension and standing posture are part of the issue. And so, with arthritic and facet related pain, we want to do a few things. First, we want to reduce that compression that's happening on those joints. That may include decompression, chiropractic adjustments, posture correction. Second, we want to improve how the spine and pelvis are moving. And then third, we want to look at the foundation. This is where people sometimes get surprised because when someone comes in with lower back pain, one of my first questions is, do you have any issues with your feet or ankles? And they'll look at me like, why are you talking about my feet? My back hurts. But if your arches are collapsed, if your weight distribution is off, if your feet are not giving you the stable foundation, then this changes how your knees, hips, pelvis, and lower back move. And so over time, that can create more stress in the spine.